South Bay reporter Jesse Gary is live for us in San Jose tonight with more on the rally today that was designed to sound an alarm about possible cuts. Jesse?
Claudine, good evening to you. And the issue of possible cuts to Medicaid generating a lot of concern by the tens of thousands of people who rely on programs either partially or fully funded by Medicaid. They say a reduction in money to Medicaid could negatively impact their lives.
Healthcare is a human right.
At the Santa Clara County building Thursday, politicians, healthcare providers, and activists joining voices in a seminal battle calling for the protection of Medicaid funding.
It's scary. It feels very dystopian right now.
The Trump administration's latest budget proposal calls for $1.5 trillion in cuts over the next decade.
They should spend their time and energy working on how to improve the quality and lower the cost of care.
Opponents say budget slashing will inevitably impact Medicaid, the federal and state-funded program providing free or low-cost health coverage to low-income people and families.
They voted to cut $880 billion from programs overseen by Energy and Commerce, 93% of which are Medicaid chips, all health care.
That hospitals across the United States will actually close their doors, close their emergency rooms if these cuts go through.
It's not just hospitals. Advocates say without a fully funded Medicaid, programs helping children and adults live full lives or even survive could disappear. Terry Downing is the rally organizer, whose disabled daughter depends on 10 Medicaid-funded programs.
They're all surrounding my daughter to make sure her life is secure and safe. And they're not being paid enough as it is, so any slight cut is going to dramatically affect her life.
The same is true for Nicole Kim, whose son Saeed suffers with Down syndrome and needs assistance to live on his own.
I mean, and every parent wants their kid to move out and live a life, and that's what Medicaid enables. You know, him living independently.
Rally attendees say the only way to prevent a possible catastrophe is for those impacted and those on the periphery to speak up, push back, and save Medicaid.
Medicaid was a part of a program that saved my life. I wouldn't be here today had it not been for Medicaid. I'd either be in prison or I'd be dead.
Mia overcame addiction and incarceration ultimately to graduate from San Jose State and now works at Valley Med. Supervisor Susan Ellenberg says such success stories would become more rare or disappear altogether if the federal government reduces the roughly $3 billion it sends this county annually. The county would have to make up the difference by digging into its own coffers, which would reduce other programs. We're live at the South Bay Bureau this evening. Jesse Gary, KTVU Fox 2 News. Claudine, back up to Oakland. To you.